Hi there, Emma here. I was going to talk to you today about sleep and routines within the first few months of your baby's life. It's something that I get asked a lot, particularly when I'm doing my baby massage classes. That's generally really tiny babies. But a lot of parents ask me, should I be doing a routine or should I be doing this? Should I be doing that? So I thought I'd just start with a really basic kind of video about routines in the fourth trimester. And probably the easiest answer and the quickest answer is no, you don't have to worry about timings and routines in the fourth trimester. So if that's enough for you, then great, you can switch off now. But if you want to learn a little bit more about sort of drilling down into the detail of what I mean, then yeah, listen on. So, when your baby is born, they will not know night from day. Um, so, they will be sleeping and waking um, frequently through the day and through the night. And then, what you will notice is slowly over the first few years of their life, is they'll slowly consolidate sleep into larger chunks overnight, and then they will have less and less sleep during the day. That's what happens naturally without us doing anything. Some babies do that quicker than others, and some babies struggle with it. Some babies wake up a lot more frequently than others in the night, as we know, and some babies find it harder to sleep in the day than others, as we know. So, what can you do in the first few months to help set them off onto with healthy sleep habits? Um, so, the first thing is no, you don't need to get them into a routine straight away. Um, it would be it's a lot easier. The first thing you can do is just to notice if there are any natural timings with your baby. It's far easier if you can follow their natural rhythms and their natural timings than it is to kind of do something because the clock says so. So that's the first thing you can do, is just notice. Some children are more obvious than others about when they're tired, and some babies will naturally get into a more of a rhythm and more regular and more obvious than others. So commonly, what you might see in the first few months of baby's life is when they start consolidating that sleep, is you will notice that they might have a bigger chunk. Say they might go to sleep at kind of 10 p.m. or something, and then you might notice that that chunk after that is a bigger chunk, 4 hours or something. Obviously these are just numbers, but these are common numbers that I hear: 10 p.m. and sort of 4 hours or something. So if you notice that, that's brilliant. That's the first step of noticing your baby's natural rhythms. So what you can do from then is that can be bedtime for baby. And that's perfectly fine to have a newborn baby, or a 4 week old, 6 week or 8 week old, whatever, going to bed at 10 p.m. You might be going with them. So because of safe sleep rules, say that before 6 months, baby should always be in the same room as you. So that includes naps and bedtime. So if they're going to bed at 10 or 9 or whatever it is, then you go to bed at the same time, then that works out really well because it means that you're staying in the same room as them. And then what you might notice over the next few months is that 10 p.m. might get earlier and earlier. So then you might notice that that they need a kind of a bedtime before 10 o'clock. So it might then become 9:30, it might become 9 o'clock. And I know a lot of people talk about this 7 till 7. It's really not necessary, especially at this young age, and it's really not as common to have like a 12-hour block of sleep. So it's okay if your baby doesn't go to bed at 7 p.m. That's absolutely natural and quite normal for that to happen, for it to be a lot later in the evening. And in terms of, like I said, safe sleep, it works really well as well because you can be with them. So that's the first thing you can do, is notice any natural rhythms with your baby's sleep. And then if we want to talk about daytime sleep, noticing how that is for them. So lots of newborn babies will be sleeping very frequently, waking up frequently, having some food, some milk, and then going back to sleep again. So it will be lots of waking and lots of sleeping throughout the day. And again, as they get a little bit older, that wake window will become a little bit bigger. And yeah, you might not notice any kind of timings with the naps until at least 4 months, or sometimes even 6 months, before they really consolidate those naps into really regular forms. So that's absolutely fine. What you can notice is how long your baby can stay awake for. That's can be quite important. So it's just learning about your baby's cues and what they look like when they're tired and how they act when they're tired. And then helping them with sleep. So newborn babies as well can generally just fall asleep in a cot, in a crib, in a Moses basket, whatever you're using. But you will notice quite quickly after a few weeks that they, or months for some, or some never, but like I said, they're all different. But some babies will wake up from that newbornness and need a lot more contact with their human, their adult, their parent, whoever's looking after them. So that's when we get into the realms of contact naps and movement naps. So lots of people get really nervous about these and think that they're setting up bad habits, but honestly, you're not. It's so natural and so normal. If you think about us as mammals, as the biology of needing to be next to your safe place, a defenseless baby is naturally going to want to cling to their safe place, their adult. And it also, if we look at the fourth trimester, about the womb to world transition that they're making, it's natural that they're going to want to be with you, to hear your heartbeat, feel the warmth, feel the comfort, hear the vibrations of your voice, and just to know that you're there. So babies love contact naps, and they also love movement naps for similar reasons. So again, they're absolutely fine. I think at this stage, during the whole of the fourth trimester, don't worry about it at all. If they're sleeping there and you're happy with it, because you need to rest and recover as well. Whether you, particularly if you've grown and birthed a baby, but even if you haven't, it's still exhausting looking after a baby. So resting, and then being next to your baby when they're sleeping, or with them on you in a sling, in a buggy, however it is, on your lap. As long as you're practicing safe sleep, then that's great. If it becomes a problem later on, then you can look to change things, but don't fear something that hasn't yet happened. So lots of people do, they worry about this setting up bad habits thing, and it's quite sad, really, that I really would hate you to stop doing something now that you're enjoying. So those baby cuddles are lovely, because you're worried about the future. So if you're happy with it now, and baby will probably be more than happy with it now, then just enjoy those cuddles, and you're not setting up bad habits at all. So the other thing I was going to just mention was about, so we've talked about bedtimes, noticing their timings and just going with that for now, and then it will slowly get earlier and earlier. And then contact naps and movement naps during the day are absolutely fine. The other thing you could start doing is thinking about daytime, nighttime. So circadian rhythms is something that all humans have in their body. But when a newborn is born, they don't have that, hence the day-night thing being the same. So over the first few months or so, your baby's circadian rhythm will be developing, and all that means is that they will start to know, their body will start to know the difference between night and day. So the way that you can help that along is by making it really clear. So one of the biggest environmental cues, the Zeitgebers, for a circadian rhythm is light. So getting that light on the eye, hits the back of the eye into the brain, and then it tells your body whether it's night or day. So it doesn't sound like much, but it is huge. So think about it when you put your baby to bed. At night time, if it can be really dark, and quiet, and all of those things that you would associate with nighttime, keep it nice and chilled and dark and quiet. Even if you get up in the night, try not to put a really big bright light on, or the blue light from a phone or a TV to see. try and use sort of a red light or something on that end of the light spectrum, because it helps with the melatonin production, which again is a really important sleepy hormone. So then on the flip side of that, when you wake up in the morning, you want to help baby's body learn that the light means daytime. So again, get that light on the back of their eye, open the curtains. If it's a nice day coming up to summer now, so getting them in the garden or going out for a morning walk or something like that. Now, something you don't have to worry about is with little ones is dark naps in the day. That doesn't matter because we don't produce melatonin in the day, so you don't need to worry about that at all. As they get bigger, you might want to block out some of the stimulation and the distraction, but it's never about melatonin production or circadian rhythms, so you don't have to worry about that unless it becomes bothersome for them. So I hope that helps. A little bit about rhythms and routines in the fourth trimester. So it's all about just chilling out. Fourth trimester is not a time to introduce strict routines to your baby. It's a time of bonding, it's a time of recovery, it's a time of getting to know them, and it's a time for rest and chilling and getting to know the new dynamics in your family. The things that you can do for help are noticing your baby's natural rhythms at night and for bedtime and for naps and what they look like when they're tired. Not worrying about how they're sleeping in terms of contact naps and movement naps, and then also helping their circadian rhythm and their melatonin production by doing a contrast with the light and the dark at day and night. I hope that's been helpful. Thank you. Speak to you soon. Bye.